Comprehensive Q&A on the surgical management of breast cancer introduction. Welcome to today's podcast, where we'll be diving deep into the surgical management of breast cancer. In this episode, we'll address over 100 essential questions, exploring everything from anatomy and diagnosis to advanced therapies and emerging trends. Pause video when you hear the word answer to attempt answer. Let's begin. Anatomy and pathophysiology. Question: what are the anatomical boundaries of the breast? Answer: medially, the breast extends to the sternum, laterally to the mid-axillary line, superiorly to the second rib, and inferiorly to the sixth rib. Question: could you explain the lymphatic drainage of the breast? Answer: about 75% drains toward the axillary nodes, and the remaining 25% heads to the internal mammary nodes. Question: how are the axillary lymph nodes categorized? Answer: level I is below the pectoralis minor, level 2 is behind it, and level 3 is above the pectoralis minor muscle. Question: what's the most common histologic type of breast cancer? Answer: invasive ductal carcinoma, making up 70 to 80% of cases. Question: I've heard about the tail of Spence. What is it? Answer: that's an extension of breast tissue into the axilla, a common area for overlooked tumors. Question: which arteries supply blood to the breast? Answer: the medial supply comes from the internal thoracic artery, the lateral supply from the lateral thoracic artery. Question: what defines triple-negative breast cancer? Answer: tumors that are negative for estrogen, progesterone, and HER2 receptors. They're aggressive and carry a higher recurrence risk. Question: what's significant about HER2/neu? Answer: its amplification means sensitivity to trastuzumab, also known as Herceptin. Question: can you explain DCIS and LCIS? Answer: DCIS is ductal carcinoma in situ, non-invasive but high risk for progression. LCIS is lobular carcinoma in situ, a marker for bilateral risk. Diagnosis and staging. Question: what is the gold standard for diagnosing breast cancer? Answer: the core needle biopsy. Question: what does the triple assessment in diagnosis refer to? Answer: it combines clinical examination, imaging like mammogram or ultrasound, and biopsy. Question: what does BIRADS classification mean? Answer: it's a system from 0 to 6, with 4 and above being suspicious or highly suggestive of malignancy. Question: when should an MRI be used? Answer: for dense breasts, lobular cancer, implant evaluation, or when the primary tumor is occult. Question: please walk us through the TNM staging system. Answer: tumor size, T1 to T4, nodes, N0 to N3, and metastasis, M0 to M1. Question: what is a sentinel lymph node biopsy? Answer: it's the identification and sampling of the first draining lymph node using dye or radioisotope. Question: what's the false negative rate for SLNB? Answer: about 5 to 10%, especially if more than 3 nodes are removed. Question: when should axillary lymph node dissection be considered? Answer: if the sentinel node biopsy is positive, 3 or more nodes are involved, or there's palpable disease. Question: what did the ACASOG Z0011 trial reveal? Answer: that sentinel node biopsy alone is sufficient for T1/T2 tumors with only 1 or 2 positive nodes. Question: and the AMARAS trial? Answer: it showed that radiotherapy is equivalent to axillary dissection for patients with a positive sentinel node. Surgical management. Question: what are the main surgical options for breast cancer? Answer: breast-conserving surgery versus various types of mastectomy. Question: what is a lumpectomy? Answer: a wide local excision ensuring negative margins. Question: what's considered an adequate margin for breast-conserving surgery? Answer: no ink on tumor, according to SSO Astro guidelines. Question: when do you recommend mastectomy? Answer: for multicentric disease, large tumor to breast ratios, or BRCA mutation carriers. Question: can you outline the types of mastectomy? Answer: simple, skin-sparing, nipple-sparing, and radical, though the latter is rare. Question: what's oncoplastic surgery? Answer: it blends oncologic resection with reconstructive techniques. Question: what is wire localized excision? Answer: using a preoperative wire to guide removal of non-palpable tumors. Question: and radioactive seed localization? Answer: it's an alternative, using iodine 125 seeds to localize the tumor. Question: what is targeted axillary dissection? Answer: removing a previously biopsied, clipped, node along with sentinel nodes in patients after neoadjuvant therapy. Reconstruction. Question. What reconstruction options exist after mastectomy? Answer. Implants or autologous flaps like DEEP, TREM, and latissimus dorsi. Question. What is the DEEP flap? Answer. It's a deep inferior epigastric perforator flap, using tissue from the abdomen. Question. And the TREM flap? Answer. That's the transverse rectus abdominis myocutaneous flap. Question. When is immediate reconstruction performed? Answer. At the time of mastectomy, provided there's no anticipated radiation. Question. What about delayed immediate reconstruction? Answer. A temporary tissue expander is placed first if radiation is likely. Question. What is capsular contracture? Answer. It's scarring around an implant. Graded 1 to 4. Question. What's the risk of lymphedema after ALND? Answer. About 15 to 30%, but it's lower with sentinel node biopsy alone. Question. What is a Goldilocks mastectomy? Answer. It combines skin-sparing mastectomy with autologous fat grafting. Question. What is fat necrosis? Answer. A common complication after autologous reconstruction. Adjuvant therapy. Question. When is radiation used after breast-conserving surgery? Answer. Almost always, except for some low-risk cases. Question. What is partial breast irradiation? Answer. It targets only part of the breast, through methods like brachytherapy. Question. When is post-mastectomy radiation considered? Answer. For large tumors, T3/T4, 4 or more positive nodes, or close margins. Question. What was discovered in the CALGB 9343 trial? Answer. Radiation can sometimes be omitted in elderly, ER-positive patients on hormone therapy. Question. What is Taylor X? Answer. A study showing that chemotherapy isn't needed for intermediate oncotype DX scores. Question. Explain the role of oncotype DX and MAMA print. Answer. Both are gene assays that help determine the benefit of chemotherapy. Question. What is the value of neoadjuvant chemotherapy? Answer. It can downstage tumors, test response, and enable breast conservation. Question. What is a pathologic complete response? PCR? Answer. Absence of residual tumor following therapy. Question. What significance does the Catherine trial hold? Answer. It showed that T-DM1, trastuzumab emtansine, improves survival in HER2+ patients with residual disease post-neoadjuvant therapy. Complications and follow-up. Question. What is post-mastectomy pain syndrome? Answer. A chronic neuropathic pain, usually from intercostobrachial nerve injury. Question. What is cording after sentinel lymph node biopsy? Answer. It's axillary web syndrome, a lymphatic fibrosis. Question. How is lymphedema managed? Answer. With compression garments, manual drainage, and, in special cases, surgical options like lympha. Question. What's the protocol for post-treatment follow-up? Answer. Annual mammograms, clinical exams every 6 months for 5 years, then annually. Question. What are the chances of local recurrence after breast-conserving surgery? Answer. Around 5 to 10% at 10 years, higher with DCIS or in younger patients. Question. What about contralateral prophylactic mastectomy? Answer. It's the elective removal of a healthy breast, but remains controversial. Question. Who should undergo BRCA testing? Answer. Those with young age onset, strong family history, triple-negative cancers, or male breast cancer. Question. What's the PALB2 mutation? Answer. A BRCA2 interacting gene that increases risk for breast cancer. Special scenarios. Question. How is male breast cancer treated? Answer. Usually with mastectomy and axillary lymph node dissection. These cancers are often ER-positive. Question. What defines inflammatory breast cancer? Answer. It's a clinical diagnosis with peau d'orange, erythema, and requires neoadjuvant chemotherapy first. Question. What is Paget's disease of the nipple? Answer. An eczematoid lesion associated with underlying DCIS or invasive carcinoma. Question. What are Phyllodes tumors? Answer. Stromal tumors. Can be benign, borderline, or malignant. They require wide excision. Question. Explain occult primary breast cancer. Answer. It presents as axillary nodal metastases without an identifiable breast mass. MRI can help localize the tumor. Question. How is breast cancer in pregnancy managed? Answer. Surgery is safe at any time. Chemotherapy is possible after the first trimester. Radiation and endocrine therapy are avoided. Question: How is metastatic breast cancer managed? Answer: primarily with systemic therapy. Surgery is palliative in select cases. Question: What is locally advanced breast cancer? Answer: T3/T4 tumors or significant nodal disease. Neoadjuvant therapy is standard. Controversies and emerging trends. Question: Is SLNB necessary for DCIS? Answer: Only if a mastectomy is planned, due to risk of finding an invasive component. Question: What is de-escalation of axillary surgery? Answer: Fewer ALNDs are now performed, thanks to studies like Z0011 and Amaris. Question: What is a liquid biopsy in breast cancer? Answer: It's the use of circulating tumor DNA to monitor for recurrence. Question: How is immunotherapy changing triple-negative breast cancer treatment? Answer: Pembrolizumab is approved for metastatic PD-L1+ cases. Question: What are CDK4/6 and PARP inhibitors? Answer: CDK4/6 inhibitors like palbociclib are used for ER+ metastatic disease. PARP inhibitors like olaparib target BRCA+ cancers. Question: What is cryoablation? Answer: An experimental method for treating small tumors. The ICE3 trial is ongoing. Question: Please explain targeted intraoperative radiotherapy. Target. Answer: It's a single dose of radiation delivered during lumpectomy. Question: What is axillary reverse mapping? Answer: A technique to preserve arm lymphatics during axillary dissection. Question: What is the lympha procedure? Answer: Lymphaticovenous anastomosis to help prevent lymphedema. Miscellaneous. Question: How does hormone receptor testing influence therapy? Answer: ER and PR status dictate the use of endocrine therapies. Question: What's involved in HER2 testing? Answer: Immunohistochemistry, 03+, and FISH testing if equivocal. Question: What is Ki67? Answer: A proliferation marker. Higher values indicate more aggressive tumors. Question: Can you compare BRCA1 and BRCA2? Answer: BRCA1 increases risk for triple-negative and ovarian cancer. BRCA2 is linked to ER+ and male breast cancer. Question: What is Li-Fraumeni syndrome? Answer: ATP53 mutation increasing the risk for a range of tumors including breast and sarcoma. Question: What is Cowden syndrome? Answer: APTEN mutation predisposing to breast, thyroid, and endometrial cancers. Question: Does prophylactic mastectomy reduce risk? Answer: Yes, by about 90% for BRCA+ patients. Question: How do tamoxifen and aromatase inhibitors differ? Answer: Tamoxifen is for premenopausal women, aromatase inhibitors for postmenopausal. Question: What is ovarian suppression? Answer: The use of GnRH agonists in premenopausal, high-risk women. Question: When are bisphosphonates used? Answer: In postmenopausal women, to reduce bone metastasis. Question: What is HER2-low breast cancer? Answer: A recently recognized subtype, which is now targetable by trastuzumab deruxtecan. Question: What is adaptive randomization in trials? Answer: The ESP2 trial uses this design for neoadjuvant therapy research. Question: What are circulating tumor cells? Answer: Their presence is a poor prognostic indicator in metastatic disease. Question: Who should get breast MRI screening? Answer: BRCA+ patients, those with over 20% lifetime risk, or dense breasts. Question: What is genomic testing in DCIS? Answer: The DCIS score helps guide radiotherapy decisions. Question: What is fast MRI? Answer: An abbreviated protocol used for high-risk screening. Question: When is axillary ultrasound staging used? Answer: When there are suspicious nodes. FNA or core biopsy is then performed. Question: Is there a consensus on post-mastectomy radiation in patients with 1 to 3 nodes? Answer: It's still controversial and under investigation in the SELECT trial. Question: Does HER2-positive DCIS get trastuzumab? Answer: No, unlike invasive HER2-positive cases. Conclusion: That wraps up our comprehensive Q&A on the surgical management of breast cancer. Thank you for joining us today. Be sure to subscribe and stay tuned for more in-depth discussions on current medical topics.